Life Depression and Community Benefits.
I'm Hannah.
I'm Olivia.
I'm Mackenzie.
I'm Audrey.
And I'm Lexi.
Our goal is at the end of this presentation that you will be able to understand the signs of late life depression and know when and how to reach out for professional help, as well as identify at least 3 community resources or activities that can help improve mood and reduce loneliness in older adults.
What is depression? Depression is defined by the presence of a depressed mood or marked loss of interest or pleasure in activities along with 5 of the following symptoms like changes in appetite or weight, sleep, energy, concentration, and psychomotor activity or feelings of inappropriate guilt or worthlessness and recurrent thoughts of death or suicide. Compared to younger adults, older adults with depression are more often show physical complaints and less overt sadness. Older adults may also present with cognitive changes such as memory impairments or decreased ability to concentrate, which can overlap or mimic dementia. Signs of depression include persistent sadness or low mood that lasts at least 2 weeks, loss of interest or pleasure in previously enjoyed activities, excessive worry about finances or health, psychomotor changes, and unexplained weight or appetite changes. Depression should not be considered a normal part of aging. Despite this, the prevalence is between 30% and 45%. Most older adults with depression are underdiagnosed. So, what effect can external issues have on our mental health? We have a couple different factors, including transportation. Limited access to public transportation can lead to isolation and missed medical appointments, as well as missing out on social interaction. Financial limitations can also affect this. The inability to work or living on a fixed income can make it hard to afford community events, healthy food, or therapy. Living situation can also affect this. Seniors who live alone may feel isolated, lonely, or anxious, increasing depression risk, as well as access to care. Lack of nearby clinics or mental health providers is a barrier for seeking help, especially in a rural place like Montana. But luckily, Rocky provides a lot of resources and programs to help combat this. First, we have transportation services. Rocky provides free transportation to any Rocky event for adults that are over 55 and live within Helena city limits. There also are many meal services to ensure that the community members are getting the nutrition that they need, including Meals on Wheels, which delivers hot, nutritious meals to homebound seniors over the age of 60. Daily Dinner Club provides noontime, well-rounded meals that dietitians help create and the kitchen staff will prepare and serve for you. The Senior Nutrition Program provides nutritious meals Monday through Friday at Rocky in Helena. It is important that you know that these programs exist because they can help make your life easier and more joyful. Taking advantage of them is not a sign of weakness or needing extra help. It's a sign of taking care of yourself.
There are a variety of strategies that can help prevent depression. The first is social engagement. Forming a strong community can be very beneficial in preventing depression. Especially as you age, it is important to stay involved and spend time with others. As you age, exercise can become more difficult, but it is important to prioritize. Exercise releases endorphins, which naturally improve mood. Long-term, exercise produces neurotrophic factors which stimulate nerve growth. Sleep has a variety of benefits on mental health, including emotional regulation, lowering stress, reducing inflammation, and supporting overall brain health. Prioritizing physical health, including exercise and sleep, but also diet and regular checkups, can increase control in your life and reduce depression. Being generally healthy can reduce stress and increase independence, including the ability to complete daily activities. A lack of stimulation can be a cause of depression, so prioritizing mental stimulation can reduce this risk. Keeping your brain active strengthens neural connections and mood regulation. If you are experiencing depression, do not be afraid to reach out. While late life depression is fairly common, it is not a normal part of aging.
Now, let's talk about the activities that seniors do at the Senior Center. First, line dancing. Line dancing is where individuals perform a certain sequence of moves in a row. Dancing, which is a form of exercise, can help lower depression. According to the Mayo Clinic, regular exercise helps ease depression by releasing feel-good endorphins that improve our sense of well-being and and lets us think about something other than worrying. Quilting is where individuals sew 3 pieces of fabric together. Seniors at Rocky Center make over 200 quilted blankets a year, which are donated to shelters, hospitals, and nursing homes, which is truly incredible. Quilting also helps stimulate the brain as well as helps with motor function. The stimulation of the brain has a positive effect on memory, which can help improve mood, help improve self-esteem, and lower depression. Next is bingo. Bingo, which happens every Wednesday at the Senior Center, is where people can compete against their friends. Doing activities that people enjoy, such as bingo, can help lower depression because this leads to lower cortisol levels, which leads to less stress and less anxiety, which can help lower depression. Next is cribbage and bridge. These are 2 very complex card games that are played at the Senior Center. Cribbage is a card game where players gain points by making card combinations. Bridge is another complex card game played between 4 people consisting of 2 partnerships. These 2 card games help stimulate the brain, which has a positive effect on people's memory, leading to a happier mood and overall lowering depression. How do these activities help? So again, all these activities that people participate in at the Senior Center, they do together as a community. This helps make people feel less alone, which helps overall lower depression. All these activities at the Senior Center also help stimulate the brains. This can have a positive effect on memory, leading to improved mood, which can help lower depression.
Community collaboration with healthcare professionals. The purpose of collaboration is to allow for early identification and screening, treatment and support, and finally, education and advocacy. An example of a healthcare professional that works closely at the Senior Center is a social worker. Social workers connect older adults and their families to community resources, counseling, financial support, and group programs. They help address barriers to care such as isolation, transportation, or financial stress like we mentioned before. Occupational therapists. Occupational therapists support engagement in meaningful daily activities that promote purpose, independence, and emotional well-being. They help clients maintain their range of motion as a key part of restoring mobility or improving an individual's ability to perform activities of daily living. Primary care providers conduct routine depression screenings during regular visits to identify symptoms early and initiate the appropriate referrals or treatment. Nurses. Nurses observe mood, behavior, and physical changes such as sleep or appetite patterns. Nurses play a key role in recognizing subtle signs of depression and reporting those concerns to your healthcare team. They also monitor vital signs and medication effects while offering emotional support and educating clients about medication routines and coping strategies. Psychiatrists and psychologists provide therapy and manage medications. Overall, the collaboration between all these healthcare professionals is used to raise awareness about late-life depression, reduce the stigma, and promote mental health literacy in the community. They advocate for older adults to access mental health services, promote healthy aging, and empower seniors to seek help when needed.
In conclusion, late-life depression is something that many older adults experience, but it's important to remember it's not a normal part of aging, and no one has to face it alone. Staying active, spending time with others, and reaching out can help make a huge difference. Our community offers great resources like the Senior Center, meal programs, and transportation services that help bring people together and lift spirits. By supporting one another and staying connected, we can help every senior feel valued, cared for, and hopeful about each day.
If you or someone you know may be struggling, please reach out for help. To get connected with resources, call the Senior Center, Montana 211, or your primary care provider. For more immediate help, please reach out to the National Suicide Hotline at 988.
Thank you so much for watching.